Now, during Breast Cancer Awareness Month, which is the month of October, we want to empower women to be proactive about their health and have a better chance to experience all that life has to offer with their families and friends. And on day one, we want to begin from basics. So let me just introduce to you my guest on this conversation on breast cancer. The seated Dr. Victoria Patty Newman is a medical officer with the Trust Hospital here in Accra, and Josephine Day Podono is a nurse with the Trust Hospital. Good morning to you. How you doing?
Fine, thank you.
Okay. So what does this month, first of all, what does this month mean to you personally as a female doctor?
Okay, so October is Pink October. Worldwide, it's a month to make breast cancer obvious among women, to increase breast cancer awareness among women. So Pink October is a month where we are able to re-echo to all women to be aware of symptoms and changes concerning their breast, and then go to the hospital as soon as possible.
Sure. Auntie Josephine, what does the month mean to you?
Oh, to me, it gives me the opportunity to reach out to women, teach them to be self-aware, and then detect abnormalities, and then come to hospital.
Okay, all right. So let's start with, what is this all about in the first place? What is breast cancer?
Okay, when we say breast cancer is any cancer, like it's the cancer of the breast. And usually cancer is abnormal proliferation of cells growing in an abnormal way. And at the end of the day, it forms a lump, and then sometimes a tumor. And normally some can be malignant or benign, but we are now talking about the breast cancer. So usually this can be picked up by palpation, clinical examination, or by ultrasound if you are less than 40, and also by a mammogram.
Okay. So who's prone to getting this disease?
Okay, there are many risk factors concerning breast cancer. One main risk factor is age. Women above the age of 50 years are prone to getting breast cancer. And then if there's also a personal history of breast cancer before in one part of your breast, you can get it. There's a higher tendency of getting it on the other side of your breast. And then also if there's a family history of breast cancer, if your mother, your sister, even your daughter has had breast cancer, you are also, it's also probably, there's a probability that you can also get breast cancer as well.
Okay.
And then if you've also inherited some harmful genes, we have BRCA1 and BRCA2, those are mutant genes. They can also cause breast cancer as well. And then concerning the reproductive history of women and menstrual history, if you're a woman and you had an early onset of menstruation before the age of 12, you're at risk of breast cancer. And then if you also had late menopause above the age of 55, you're also at risk of breast cancer. And then if you've never breastfed before and you've never had a child before, you're also at risk of breast cancer. And also if you are having children but at late age, like 30 years, you're at risk of breast cancer. And then women who often take alcohol, and then women who are obese too are also at risk of breast cancer. And then also when there's increased, women who do not exercise can also get breast cancer.
This is tall. I didn't think so.
Yeah, a whole range of,
wow.
Yeah, very interesting.
So what it means is that all of us are at risk then? Because we fall into one category or the other.
Exactly.
Yeah.
Exactly.
And just anything you want to add to what she said?
No, I was going to say every woman is at risk of getting breast cancer. So all women should be breast aware.
I want us to zero in on how to do the self-examination. So can you detect, how early can you detect it?
Usually it's supposed to be a routine check you do monthly, like based on your period. So usually it's recommended to do it a week after your period, when your breast is less swollen, because before your period, your breast, due to the premenstrual syndrome, your breast becomes swollen, gorged, so you're not able to pick up anything different. So after your menses, a week after, usually that's when you're able to do it. So it's recommended that women do it monthly. And if you're a woman and you're not having your menses anymore, like a menopausal woman, you are supposed to get a set time of the month that you'll be checking your menses every time.
Okay.
And you'll be checking your breast every time. Sorry.
sure.
Yeah. So basically, it's more like it should be a routine thing. So that based on that, you should also be aware of how your breast feels like, so that when there is a change, you're able to pick it up as soon as possible. Yes. So, so what happens is that you would have to. I'm demonstrating how we do the breast
Okay, let me come
examination.
to Auntie Josephine, then we'll come to the demonstration.
Okay.
There are a lot of people that you check people.
Yes.
How do you do the discovery?
It's by palpation, one. And then from patient's history. Most of the time, patients come telling you, oh, I noticed this and that in my breast when I felt it or when I touched. So when you go examining, then you pick it. Yes, with the hand.
Okay.
Or you do a scan, ultrasound scan, or a mammography.
With the ones that you've seen, at what stage do they report?
Some come very early. Some come very, very early. Cancer in situ. Some very early. And then others too late.
Okay.
Yes.
Okay.
Yes.
But when they come, are they sure what's happening, or it's just the discovery and they want to know what it is?
They just want to know what it is. Because they've heard a lot. Lump, when you have a lump, you have a cancer, so they come. The moment they pick a lump, they come.
Okay. All right. So please take us through how to examine.
Okay, before that, I wanted to add
Please do.
Most of the time when they come in, they have this fear that they already have breast cancer. So they are already afraid. And they are like, doctor, I think I found something, man. Am I going to die? So I just want to echo that out to them, that they should just come in with, because having a lump in your breast does not mean breast cancer. We have fibroadenoma, which is most common in women less than 35 years.
Okay.
So you shouldn't be afraid. So because of that, they report very late, and that's when nothing can be done, because treatment is based on the stages. Okay.
But this can be treated, right?
Yes, it can be treated and cured. Yes.
Okay.
Especially if it's detected very early.
Okay. So take us through how we can even begin to discover that there's something foreign in our breast.
All right. So basically, the normal thing at home, when you're having a shower, you can examine your breast. And then also you can look in a mirror, you can examine your breast. And then also when you are lying down. So in the shower, for example, when you have soapy water on you and your body is slippery. So what you do is that you raise your hand up above your head.
Okay.
And then you'd go in circular motion around your breast towards your nipple area, and making sure you are also palpating to see if there is any lump that can be picked up.
Okay.
And then you get to the nipple, you also squeeze to see if there's any nipple discharge, any pinkish serous or passy discharge. And then you also go towards your armpit area, because some of the breast tissue is in the armpit. So you make sure you check for any lymph nodes. You go around your axilla region. And then also you make sure you palpate below the clavicle. And then you make sure you pick up to see any, so it's quite a wide range of a wide region you palpate. Okay. So you below the collarbone, down to the bra line, and then mid-axillary line, you palpate. That's for for the shower. Then in front of the mirror, you would raise your hand above your head, as both hands, and then you observe to see if there's any change in symmetry, any change in size, any dimpling of your breast, any change. We have something called pod orange, and that is, it looks like an orange peel. That's more like specific for breast cancer, or mastitis, which are differentials of breast cancer. So it's more like a pod orange. You see like an orange peel swollen, and then also there could be ulceration. There could be swell, and there could be sores, and then also there could be dimpling and puckering, like any change you see with your breast. So then what you do is that after you've noticed that, then you place your hand on your hip, and then you flex your chest muscles. In doing that, you tighten the chest muscle. When that happens, anything that is hidden like a lump comes out, so you'll be able to see it. Even you can pick up some lumps before even palpation. So you make sure you do that. So after you do that, then you have a couch or your sofa or your bed. You lie down, making sure there's a pillow at the back of your shoulder.
Okay.
So you take one breast at a time. So you lie down and then you place you lift your left hand above your head, and then you use your right hand, the parts of your right finger, to palpate the breast in a circular motion, tissue by tissue. Make sure you go around. As I showed earlier, you are starting from below the collarbone to the bra line, and then mid-axillary line. You check, make sure everything is okay. And then if you could also do it vertically. You can palpate this way, then you come up, like making sure you don't miss anything.
Okay.
Then you repeat the same for the other breast.
So you're doing, can you do one and leave the other? Because you started from the bathroom.
The bathroom can do it and leave and forget about the mirror.
Okay. All right.
You could do the mirror one.
Forget about the bed.
And forget no. I think ideally the mirror bed should follow.
Okay.
Yes, but with a shower there's no mirror, so.
Okay. All right, so we're talking breast cancer. Fortunately, I've got a video of how to, if you missed the explanation, or if you missed the steps to take, here's how you could also do it. The mirror bed that you mentioned, Dr. Newman. This is a woman looking at herself, obviously, in the mirror.
Okay.
What you're seeing on your screen now.
Yeah.
Okay.
Obviously, she's checking for symmetry of the breast. She's checking to see if both breasts are equal. But obviously, not one breast can be bigger than one. Slightly. It's not supposed to be exactly the same.
Okay.
Yes. So, yeah. So then she's doing the circular motion round. Yes. Raising her right arm. Sorry.
Okay. So, you know, naturally there's something in there. I mean, there's something in there. So what exactly are you asking us to?
Yes, exactly. I have that a lot from the women when they come to the consultation room. They'll be like, doctor, there's something in there, so what am I looking for? That's why I'm saying you have to familiarize yourself with your own breast. Because there's a lump there, especially in women below the age of 35. Some women, post-menopausal women, even come and then they also have that firm kind of breast with that lump. So that one lump there is not what we are looking for. So when you are more familiar with your breast, when something different comes up, you'll be able to pick it up.
Okay. So now a lady on the screen is lying down. Is that that's the right posture?
Yes, exactly.
Okay. And again, you're trying to look for
the lump.
The lump in the breast.
Yes, please.
So how long do you do it? When you lie down, as you check, as you go around, how long
it
should
does not necessarily have a time frame, but just being meticulous, taking your time to do it. Roughly about some 5 minutes would not be a bad idea. Not so long.
How can the men help?
Well, that's also very interesting and very good, because we encourage the men to play with their wives.
After all, they do a lot of the playing with it.
Exactly.
So how can you, as you play, help detect that?
Yeah, so I wish that men also learn how to examine from the video and other places. They read about it and then they just pick it up. And most often, surprisingly, they come to the consulting room. My husband said there's something in my breast. Is it true? Examine.
Oh,
yeah,
okay.
it's common. So some of the men are doing very well. Some of the men are doing very well.
Auntie Josephine, anything to add to when you know the self-examination, how you can detect it yourself?
I think Doctor has said it all.
But you also came with some pictures.
Yes.
Some things that you wanted to show us. Okay.
It is what to look out for.
Okay.
So I talked about the pulling in of the nipple, the dimpling of the skin of the breast, reddening of the skin of the breast, discharge. Can flip it.
Okay.
So that's the peau d'orange.
This is the peau d'orange, and this is the pulling in of the
Retraction.
nipple, retraction.
So if your breast looks, and I hope that the cameras can take this, if it looks like this, then it means there's a problem. Is that it?
That's please.
Okay. So if you can still get what we are saying in terms of how to self-examine, but you can see these pictures on your screen, and that's how your breast looks like at some points, then that's a sign that you should go to the health facility and let them check it out for you. Okay.
If you find a lump in the armpit,
A lymph node.
a lymph node,
Okay.
and then
And then also that's the swelling of the breast. They ideally should have shown two to see how one is bigger than the other. But obviously the message they're putting across is that when you notice your breast is swollen than usual, apart from the premenstrual syndrome, that usually your breast gets gorged. When you notice that there's something throughout the whole month, like throughout the whole cycle, then you'd have to place a concern about
All
that.
right.
So this is
nipple discharge.
nipple discharge.
Okay.
Bloody nipple discharge.
So you're squeezing the nipple as you do the self-examination
Yeah,
to
so-
see if there's a discharge like this.
Yes.
And if there is, then that's a good reason for you to start running to the
Yes.
health facility.
And then
Okay.
thickening of the skin of the breast.
Thickening of it.
Yes.
How?
Yes.
That's the podorange. It's the early stages of the podorange.
Okay.
So the skin, the
This.
dermis, the epidermis, the skin becomes thickened,
Okay.
and it's
Okay.
more like it's
Like an insect bite.
yeah.
Okay.
That,
Okay.
that's-
If you're breastfeeding, can you also begin to see these signs?
when you're breastfeeding reduces the risks of breast cancer to a very large extent. So we
Okay.
encourage women to breastfeed as much as time they have. They can breastfeed their children, and usually most women come with mastitis of the breast. That's when the baby sucks the nipple and they're sore, and then infection comes in. It looks similar like breast cancer, so it's kind of very hardened and very, very painful. The breast becomes inflamed. So they come and they think it's like breast cancer. Then we just
Okay.
treat with antibiotics, some painkillers, and then after a week they are fine.
Okay. This is the final page of the signs and symptoms.
So-
Yeah. So
this
that's
is scalding of the breast. It feels like a rash sort of, that is scaling off.
Okay.
And then the last but not the least is reddening of the
Okay.
breast.
So if you see any of these signs, but you could have these signs and it will still not be breast
That's-
cancer.
exactly.
Okay.
Exactly.
All right.
I had this one patient that had an accessory nipple, and she had her own nipple, but there was one nipple growing bilaterally, and she actually thought it was breast cancer because she had been pinching, squeezing it, so it had become ulcerated and looked sore. So she came in crying and all that. So we examined her. I called in the surgeon. We examined together. We picked it up as an accessory nipple. We just gave her antibiotics. In a week's time, we told her to report, and it had all gone. So, I mean, you should just come and just be sorted out. There's not anything scary. Yeah.
Okay. So, when you, because in the course of this month, we will talk about how people have survived it, but this can also be very expensive if you have it. So once you go to the health facility to check and you're told that, yes, you have breast cancer, what should you immediately do
As a
person, yes?
Okay, and when you are told you have breast cancer, we just don't tell you you have breast cancer just like that. What we do is that we refer you to the surgeon. The surgeon does a biopsy of the breast and sends it for cytology and analysis. And then it comes with a specific type of breast cancer you have. It can be ductal, it can be lobular. And then if that happens, what we do is that we counsel you. We have the psychologist on board in Trust Hospital. So we counsel you. I mean, we let you get there with us. And most of the time they come early. So we first of all tell them that there's a cure and we are ready to help them in any way as much as can be helped. So what we do is that depending on the stage of the breast cancer, we have stage 1, stage 2, 3, 4. So depending on the stage, we have surgical removal of the breast, mastectomy, or we can do radiation, or we can do chemotherapy, depending on the stage of the breast. So it's a holistic something, and it's going to be for some period of time. And then we'd also have to tell you the side effects of the medications you are taking, because some of them have, nausea, weight loss, hair loss. Yes. So basically, and you are not left alone. there is follow-up and all that. I recently saw one woman last week. She's a breast cancer survivor. She's lived for 10 years, and she's had one breast off, but then she makes a conscious effort to come every year for her mammogram
to check the other
one. So when we do the mammogram and we find out there's something more into it, then we do the breast scan for her, because she's about 40 years, so she needs to do the mammogram first. Then when we do the breast scan, we find out something, then we do the biopsy.
Okay. So what stage is very common in Ghana with your experience with what you've seen and done?
Normally they come stage 3, stage 4. That's the
Wow.
late, yeah.
Wow.
They come stage 3, stage. Basically, we just do palliative care for them. There's nothing much you can
What's
do.
that?
That's symptomatic care treatment. Okay, I'm in pain, give you morphine. Okay, I feel like I'm weak, we give you some vitamins. It's not like we are curing the cancer, because it has actually invaded the whole body. We call it metastasis. It can invade the lungs. It can
So you're just waiting to die, in other
Exactly,
words?
more like that.
Wow.
That's
So Auntie Josephine, is there a reason why people report late?
Yes. One reason is fear of the unknown, and then fear of being told I have cancer. And when you are told you have cancer to them, it means a death sentence. So they wouldn't come at all.
Are there times that you have people who also visit the churches, who go for prayers, hoping that could cure them? They
Yes.
realize that it cannot, so they come,
Yes.
they report late.
Most of them, when they come and they are told, they go and then go round herbalists, churches, and then when it is late, then they come back.
So we're talking breast cancer, and my guest, Dr. Victoria Patty Newman, is a medical officer with the Trust Hospital, and Josephine Day Podono is a nurse with the Trust Hospital as well. So we're talking about you finding a lump in your breast, first of all, when you do the self-examination. But how does this lump look like? We've got a video to tell that story, so let's watch this. Okay, so now that we know all the basic rules, I hope that if you're home and you're watching, you're beginning to raise those arms and try and see if you can figure it out. But if it's becoming very difficult, you don't know what to still look out for, then you know that, especially because we're in this month of October, you need to go to a health facility and have it checked out. How often should we be doing this checking thoroughly to see if we have something or not?
personally or with the hospital?
Personally.
Personally, monthly, like
Monthly,
I said.
okay,
yes,
every
monthly,
month.
Every month.
So if you still can't check it yourself, do you still go to the hospital every month to check it out?
Usually, initially, you'll be coming, but with time, you would get to know how to do it. So they come. They come. Sometimes, what we advise is that you don't wait. You're supposed to do it annually. Like, whenever you feel funny about your breast, you feel there's any changes, you come. So I can get a patient coming to me like 3 times in just 2 months. So with time, she gets used to her breast, and then she picks it up from there.
We didn't mention itching, but could it be
Yeah.
if your breast itches?
Yeah.
Could it be a sign that maybe, okay.
Yeah.
Well,
Anything unusual about your breast that was not there before, your onset of menarche,
okay.
you have to report to the
All right.
hospital.
I know that the Trust Hospital is also doing something. So tell us about, first of all, your well-being clinic. You've got a well-being clinic.
Okay, so we have the Well Woman Clinic.
Well woman.
Yeah, what we are interested in is women of reproductive age. We do both breast cancer screening, and then we do cervical cancer screening as well. So with the breast cancer screening, we do the palpation to pick up lump, and then we further do the breast ultrasound. And then women above, that's for women below 40 years. Then women above 40 years, we do the mammogram. So with the mammogram, it's an X-ray picture of the breast, and it picks up lumps that cannot be palpated before it gets bad. It's able to pick up small lumps.
Okay.
So it's more like things we do over there. And then even though we are not doing cervical cancer, we also do pap smears as well. That one is done every 2 years. Yes, and if you're a woman below the age of 35 years, let me just chip it in. We have the Cervarix vaccine that helps to prevent the risks of getting cervical cancer as well.
Okay.
Yes, which can be given to you below 35 years. So when you come and do the pap smear, we find you are negative for any cervical dysplasia or intraepithelial lesion. You don't have that. we recommend the Cevarix vaccine for
Okay.
you.
All
Yeah.
right. Auntie Josephine, so what are you doing today?
Today we're going to launch at the Trust Clinic Dansoman. Yes, and then screen women.
So so it's the screening is free.
It's
a
free.
free
Yes.
screening.
Yeah.
So anybody who can just come
So
to
today is the launch. We are doing the launch at 10 a.m. at the Trust Clinic, Dansoman, opposite Dansoman Baptist School, Dansoman Roundabout.
Okay.
And then on the 12th, we'll do the breast screening for all Dansoman women, community women, and then our corporate clients we partner with in the banks. All of them should come to Trust Clinic for free screening.
Okay.
That's on the 12th. And then on the 17th, we have a talk and screening at the NDK, at NDK for this thing, breast screening.
Okay.
And then we have one at Osu and one at Tema.
All right. Okay. So we wish you well. We also have our own stuff going on.
Yeah.
And then in the course of this month, we will also tell stories of people
And then not
who
to
have survived
forget,
and
we'll
people who are
also
living with it.
Not to forget, we'll also do breast screening for Osu Community Market, the women there. So if you live around there, the area, in the market women, we will do breast screening for them.
Okay.
That
All
will be
right.
on the 17th.
Okay. All right. So thank you for being here, Dr. Victoria Patty Newman and Auntie Josephine Day Podono, all from the Trust Hospital. We wish you well with your program.
Okay.
All right.
Thank you.
Stay with us. We hope that we've been really helpful this morning. And if you don't take anything at all from the conversation, please remember how to check for the lumps in the breasts. And remember that if you have not gone to the hospital to do any examination of the breast at all, because we're making so much noise in the month of October, you take the opportunity to do so. Stay with us. We've got more coming up here on the show.